guys, welcome to episode 145 of ADHD Knowledge Exchange. Today is in response to Jordan Peterson's comment as well, which I did in the previous episode, episode 144. Now I'm going to introduce you guys to what happens to ADHDers without medication when they actually need it. So, first, you're unable to make decisions. You're unable making any decision, even simple one, seems like an impossible task. You may start to overthink or overanalyze all your options, leading you to feel overwhelmed and scared at making the wrong decision. All right, now what happens to your body when you stop taking ADHD medication? Symptoms generally last 2 to 4 weeks and can include abdominal cramps, depression, irritability, sleep problems, to suicide. There is no treatment for Adderall withdrawal, but getting regular exercise and eating a nutrition-rich diet can help. Remember to talk to healthcare provider before stopping Adderall, definitely. Relationship issues can arise as well, such as communication problem, increased conflict, relationship instability, and etc., etc. The mental health risks that's involved are increased risks of depression, anxiety, and suicide. Untreated ADHD can contribute to low self-esteem, feeling of frustration, and difficulty coping with challenges, increasing the risk of depression and anxiety. And I cannot stress enough that you get a proper ADHD testing, and that can only be done by psychologists who are licensed to carry out the DSM-5 exams. Now moving on to DSM-6, but it's not out yet. As of 2025 August. All right, higher risk of either other psychiatric diagnosed disorders. ADHD can also be linked with other conditions like bipolar, conduct disorder, oppositional defiance disorder. Well, that's part of ADHD. Antisocial personality, it can be misdiagnosed as borderline personality as well, and definitely increases suicide rate. Other potential risks, such as risk of behavior, increased risk and accidents because we're clumsy by nature, higher mortality rate. Some studies suggest a higher mortality rate associated with untreated ADHD, potentially due to the risk behavior and other complications. The importance of medication, when appropriate, can help individuals with ADHD manage their symptoms and improve their overall functioning. It can enhance focus, reduce impulsivity, and improve emotional regulation, making it easier to succeed in school, work, relationship, etc. However, medication is just one tool, like I said, many episodes. You always talk to your psychiatrist, always talk to your GP or general practitioner, family physician, and look up cognitive behavioral therapy, CBT, or dialectical behavioral therapy. And that should help, and definitely once your medication is stable, CBT should still continue. Being ADHD is a life learning, I would say, experience. You discover what you're good at, what you're bad at. You get help for it. You get stronger. You get different thought because you're different. There's so many good things about having ADHD, and the importance of medication is part of the treatment along with CBT. Talk to your family physician and psychiatrist. Thank you.